have my MAR and I have my antibiotic. So I want to do my label checks. I'm going to do 2 label checks at the med cart, and then I can do 1 at the bedside before I administer to make sure that I have the proper medication. So just like we did before when we did our label checks, I have Sleepy White, date of birth 1/15/1951, ID 455-353-8401. Allergies are penicillin and sulfa. I'm given Levaquin, so they're not allergic. I'm given Levaquin diluted in 100 milliliters normal saline, 500 milligrams q-day. IV route, I'm going to administer over 30 minutes at 0900. It's 0900 now. And in my hand, I have Levaquin, 500 milligrams for IV administration over 30 minutes. Expiration date 12/31/16. So I've done 1 label check. I'm going to do a second label check. So for Sleepy White, 1/15/1951, patient ID 455-353-841, allergies penicillin and sulfa. I'm giving Levaquin, they're not allergic to that. I'm giving Levaquin diluted in 100 milliliters normal saline. I'm giving 500 milligrams q-day IV to be administered over 30 minutes at 0900. It is 0900 now. And in my hand, I have Levaquin 500 milligrams to be given q-day IV over 30 minutes, and it is unexpired. So I've checked my label twice. So down lower on my MAR, I noticed that I have my flushes on there. So I'm going to give a flush before I initiate my antibiotic, and then when it's done and I discontinue it, I'm going to flush my IV again. So I'll need 2 flushes for this procedure. And then it also says that the patient has sodium chloride, 0.9% primary IV fluids, PRN. So they already have that at the bedside. So I'll need to check that 3 times when I go into the room. I'm going to use the primary line of normal saline, and I have Levaquin diluted in normal saline. So I'm fairly confident that they're compatible, but if I had any concerns, I would check compatibility with my micromedics or my drug book. Okay, so but I'm pretty sure they're intact. So I have my medication. I've done 2 label checks. I'm going to get 1 of my flushes and get it ready. So this is normal saline, 0.9% sodium chloride injection. It's unexpired. 0.9% sodium chloride injection. It's unexpired. I'm going to bump the air out. Put the cap back on. I'm going to need my secondary tubing, which is intact, unopened, and I don't see an expiration date, so we'll say it's unexpired. And I'm going to need some gloves and alcohol pads to go into my room. So I have everything I need to go into my patient's room. So I'm going to go in my patient's room, knock, 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 knock. Hello, Miss White. I'm Susie. I'm your nurse today. I'm here to hang your antibiotic. Is that okay with you? And she says, yes, it is. I have a little armband here with her. And I'm going to do my double identifiers. Can you tell me your name and date of birth? And she says, Sleepy White, 1/15/1951. I look on my armband. It matches. I look on my MAR, it matches, and I'm going to check the medical record number, 455-353-841, 455-353-841. Could you tell me your allergies? She says penicillin and sulfa. Excellent, we're giving Levaquin, it's not one of your allergies. And can you tell me where you're at today? I'm at the College of Nursing. Can you tell me what month it is? It is November. Can you tell me who the president is? And she says Obama, so she's alert and oriented. Okay, so before I get started, I'm going to pick up my MAR, and I'm going to look at the bedside for those primary IV fluids. And I need to do 3 label checks on this. I was unable to do that outside the room because it's inside the room. So I have my MAR. This is for Sleepy White. She is getting sodium chloride primary infusion IV. She's getting it PRN. We're going to use that now. So up here I have sodium chloride. This is for Sleepy White. It's unexpired. This is fluids is less than 24 hours old. You need to say that at least once. And this is an intermittent infusion. So remember, our tubing has to be less than 24 hours old as well. If it was continuous, you could use the tubing for 96, right? So, but your bags, incompetency will be labeled less than 24 hours to remind you to say that at least once. You're using your bags today, so they don't officially say that, but you can say that they are less than 24. So second check, this is for Sleepy White. I am giving sodium chloride 0.9% primary IV fluids. They're to be administered IV route, PRN. I'm going to use them now at 0900. And here hanging, I have 0.9% chloride is unexpired, it's less than 24 hours old. Tubing is less than 24 hours old. So I'm going to do that a third time for Sleepy White. I have sodium chloride 0.9% primary fluids to be administered IV route. Is to be given PRN, so I'm going to use those now at 0900. And hanging up here, I have 0.9% sodium chloride. It's unexpired, and the fluids are less than 24 hours old, and the tubing are less than 24 hours old. So that matched. While I'm doing checks, I'm going to go ahead and do my final check at the bedside. That'll let them in here on my Levaquin. So this is for Sleepy White. She has an order for Levaquin diluted in 100 milliliters, 0.9% normal saline, 500 milligrams Q-day IV to be administered over 30 minutes, to be administered at 0900. It's 0900 now. And in my hand, I have Levaquin, 500 milligrams Q-day IV to be administered over 30 minutes, and it is unexpired. So that matches my MAR. And then I brought in my flush. I'm going to check that one last time. 0.9% sodium chloride injection, and it is unexpired. So I've done 3 checks on everything I need to do 3 checks. I've identified my patient with double identifiers, I've verified my allergies, and I've done level of consciousness. So now what I'm going to do is assess my IV site for patency. So I'm going to put on some gloves. An alcohol pad. How long am I going to scrub my hub for? So scrub for 15 seconds. In competency, you need to say that each time that you would scrub it for 15 seconds. The first time you scrub it, you need to actually do it for 15 seconds. Okay, after that, you can scrub and say it was 15 seconds. But the initial time, I want you to take the 15 seconds to do it. Okay, so remember the little song or little poem or whatever it is that you have in your mind that takes you 15 seconds to say, and say it to make sure you do 50 seconds. Go around the sides and back and forth across the bottom. I'm going to put my alcohol pad under there to lay it on their skin. I've already bumped out my air and checked my syringe. I'm going to attach my flush syringe to my IV site. And I'm going to pull back. I get blood, and as I'm flushing 2 to 3 milliliters, I'm checking for infiltration and phlebitis, and I don't see any signs. How does that feel? She says it feels fine. So my IV is patent. I'm going to get down my IV primary line. And I'm going to check it's already primed, and there's no air bubbles in it. And at the competency, it will be already primed, and you can say it's primed and there should be no air bubbles. So it looks good. So I'm going to take another alcohol pad, and I'm going to scrub my site for 15 seconds. So I'm singing my Twinkle Twinkle. And then I hold it up and take my cap off my fluids and put it on there. Should have been capped. And then I'm going to check this for patency to make sure my fluids are running and my primary is fine. So I'm just going to open it, and we're going to go KVO, slow it down, and let it infuse real slow for a little bit to make sure that the tubing is patent and that, again, the IV site is patent, and that's all working. So then I'm just going to turn it off. Now I'm going to get ready to do my secondary tubing and my antibiotic. So I have my tubing. I'm going to open it, and I forgot to do what I should have done outside the room. I should have done, what should I have done before I come into the room? I should have washed my hands if I didn't. But there's a major thing, drop factor, yeah. So I should have done this outside the room. I would have, but I haven't infused it yet, so I can do it now. So I have my tubing here. My drop factor is 10. How many minutes am I infusing? 30. And what's my volume? 100. So if I multiply, I get 1,000 over 30. And I need to do the math. So 30 goes into there. 3 is 90. So it's 33.33333. So that's 30 33 drops per minute. I'm going to divide by 4 to get my drops in 15 seconds because I'm going to have to count this. So it's going to be 8 point, I don't know, something, but we're going to say it's 8 because I don't have my calculator. I'm going to double check my math. We're going to remember how we did our math in our first competency. We're going to double check it twice. So I'm going to set it up again. Drop factor is 10. Time is 30 minutes times my volume of 100. I go 1,000 over 30. I multiply that out. I get 33.333. I'm going to round that to 33 drops per minute. I'm going to divide by 4, and I get 8 drops per 15 seconds. All right. I would have done that earlier, but I forgot. But I needed to do it before I infused, and I did it before I infused. So I've already done all my label checks. So now I've opened my packaging. I'm going to close my roller clamp. I still have paper on here. I'm going to take the paper off. Since I have this in my hand, I need to drop my primary bag lower than my secondary bag. So since I have it right now in my hand, I'm going to do that. I'm going to put this hook through the bag and put that up there. So now my primary bag is lower. I've closed my cap or roller clamp. I'm going to get my antibiotics in my tubing, take off my spike cover, pull off my bag, and I'm going to spike my secondary bag just like we did our primaries. Just push it in there up into that little hub, and I'm going to take this over here. I need to attach this to my primary, so I need an alcohol pad, and we're going to attach it to the port closest to the bag, the most proximal or distal from your patient port, but closest to the bag, so the one right below that little flying saucer backflow valve. I need to scrub that for how long? 15 seconds. Every hub scrubs for 15 seconds. 15 seconds has passed.
And you want to prime it first? Prime it first?
Not yet.
Okay.
I'm going to though. So I'm going to attach this to my port after I scrubbed it, and I made sure that roller clamp was closed. If I didn't make sure that roller clamp was closed, fluid would come right back, but I want to regulate that. So now I need to prime this tubing before I use it. So I'm going to back prime it with my primary line. So all I'm going to do is hold this bag at level or below my primary bag and open the roller clamp to my secondary bag, and you will see fluid will come back in there and into my chamber. I'm going to let it fill, you know, roughly half or to that little T, and then close that clamp. I'm going to hang this up here. So all clamps are closed and everything is primed. Everything is checked. Everything is calculated. So I'm ready to infuse. So what I'm going to do is open up this roller clamp. Remember we said last week secondary clamps don't regulate, they just open and close. So I'm just going to open that and nothing happens because it doesn't regulate, it just opens it, and my other is closed. And now that it is higher than this bag, it's going to infuse first, okay? And I'm going to watch this drip chamber for my 8 drops in 15 seconds. And I'm going to regulate it with this roller clamp. Okay, so I'm regulating my secondary bag with my primary roller clamp. I need 8 drops for 15 seconds. So again, I forgot my watch this morning, so I have to use the clock. It's gone a bit fast. So I'm watching in here, counting the drops for 15 seconds, and it took me quite a bit of adjustment. So if it was like every minute, it would take me longer. That's why we do the divide by 4 to do 15 seconds to regulate. So I'm done with this. I'm going to coil it back onto my patient's bed, make sure everything is good. Are you doing okay? They said, yeah, if I had raised the bed, I'm going to lower the bed. If the rail was up and I put it down, I'm going to put everything back. I'm going to take off my gloves, wash my hands, and then I can leave the room with my MAR. So I'm outside the room now and I have my MAR. So I'm going to put my initials next to the 0900 because I hang that at 0900. And then down here where it says flush PRN, I gave one of those at 0900 before I hung that. So I'm going to do 0900 and my initials. So